Hello, everybody, and welcome to O2 Classroom. I'm Lisa, and I'm the producer of O2 Classroom and also the educational content developer here at First Class Medical. We're here every Tuesday to talk about topics that will help you better manage your lung condition. And this show, a lot of times, is driven by questions that we get in our private Facebook group, which I'll put the link here if you're not a member yet. There's 5,000 people like yourself who are battling a lung disease, and they share tips. You can ask questions, you can share things that have worked for you. And most of all, I think people are just in there supporting one another, having a few laughs. We got some good cast of characters in there. So join us if you haven't already. And this question is actually from a viewer from last week, Tanya, who has watched, before, asked good questions and things like that. And she asked last week about boosting energy levels. And that's no surprise because it's estimated that people who have a lung condition, of those people, up to 50 to 70% of them also suffer from fatigue. So it's not unusual that she asked that question. The reason for it is, debatable. There's several theories. The one that's most widely accepted is that if you have a lung condition, you have a loss of lung elasticity, as you probably know, which means that CO2 sometimes builds up in your lungs and you just can't breathe as well. So you're having more CO2 built up and you're having less O2 into your bloodstream. So that's just going to kind of make you feel sluggish and tired. Another thing is that just if you have a lung condition, depending on, how advanced it is and things like that, you're using a whole lot more calories than somebody with normal lung function would use just in the simple act of breathing. People who have sort of normal lung function use anywhere between 50 and 75 calories per day breathing. Somebody with an advanced lung condition can use up to 750 calories, more than 10 times in some cases. So you're just using a lot of your energy. All the energy that we get from food is translated into units that known as calories, and that's how we measure how much energy we get from any amount of food that we eat. So when you're burning up that many more calories, you're naturally going to have less energy to do other things. So we're going to go over some things today about how to, first of all, conserve your energy. That's the first thing. That's the first and the easiest thing to do. The second thing is going to be how to boost your energy so that you're eating things that are going to be good for your lungs, good for your health, and also not going to make you more tired than you were to begin with. So first of all, like I said, we're going to start with some ways that you can go throughout your day that are going to help you maintain your energy levels better. The first thing is, we've talked about this before, active cycle breathing. When you get up in the morning, start with that, because that's going to, first of all, clear out any congestion that you have in your lungs. It's going to relax those airways a little bit. It's just going to help your breathing get a little bit better. The more open your airways are, and the better you're breathing, the better your energy levels are going to be. If you don't know how to do active cycle breathing, there's videos on our YouTube channel. There is a free class on Thrive, which I'll put the link here. If you haven't taken those free Thrive classes, I highly recommend it. It is COPD 101, things that you need to know to manage your respiratory condition effectively, to slow progression, to prevent further lung damage, and just, make your day-to-day a little bit easier. So start your day with active cycle breathing. Do active cycle breathing before you eat, because that's just going to help your digestion a little bit. It's going to help you feel a little more comfortable while you're eating. And also do it maybe 15, 20 minutes before you take your inhaled medication. As those airways relax and open up a little bit more, you're going to be able to inhale that medication a little bit deeper, and it's going to be able to get down there where it needs to be to help your lung condition. It's not going to do you any good if it stops here in your throat. All it's going to do is probably make you a little jittery. So as deep as you can get it down there, the better. So start that out in the morning. And sometimes, we get up in the morning and it's just like, it's sort of a mad dash to get out of the house. But if you have a lung condition, doing things that you need to do to get ready, such as getting dressed, which is a lot of bending, which means that you're sort of constricting your airway, your, lung cavities, or bathing, because the humidity in the shower can, affect your breathing, just like humidity outside. Can be tiring. So you want to just give yourself a little bit of time in the morning. And it means, you can get out of the house at 10 instead of at 9. So be it. So give yourself a little bit more time in the morning. Try not to rush. Try to manage your bathing a little bit better. Turn on the exhaust fan so that maybe make the shower a little bit cooler, and turn on the exhaust fan so you're not getting so much steam in there. So it's not affecting your breathing as much, because that'll definitely make you tired. Sit if you can. A shower chair or shower bench is, a good tool to have. Why expend energy that you don't have to? If you can just sit for a minute, do so. Another thing you might consider doing is bathing at night before you go to sleep, because then you can just sort of lay down, rest, feel a little bit more refreshed, and in the morning just do some basically bathe at the sink, or just take a more quick shower where you're not washing your hair or whatever. That might help you have some more energy in the morning, and when you're already tired at night, when you need to go to bed, try to do some bathing there. No rushing. Circulate air in the bathroom. And instead of using a towel where you have to bend and stoop and things like that, get a nice big terry cloth robe, or they have actual wearable towels now that look more like sort of a poncho. Wear that. And if you're getting ready, combing your hair and things like that, don't do it in the bathroom where it's still steamy and humid. Go out into the bedroom, or, somewhere else where it's, just a little bit better ventilated and not so steamy, so you can get ready there. That'll help your breathing and also help you feel a little more energized. Sit down while you're getting ready. And posture is so important. We did a whole show about posture. So if you are eating, slumped over, or you are having a hard time breathing and you're tensed up because your shoulders are scrunched together, you're closing off this cavity here where your lungs are trying to expand, and they're having a hard time anyway because they have lost their elasticity. Don't press down on your diaphragm. Your diaphragm, pushes up on your lungs, and that's what brings that CO2 up and out. And when it goes back down, that's what brings the fresh air in. So you don't want to sit like this. So that goes with a lot of things that you are doing. Like I said, when you're bathing, you don't want to doing a lot of bending, and same to go with clothing, getting dressed, things like that. Sit down to get dressed. There are aids that you can do to help get socks on, slip-on shoes, so you don't have to bend over to tie your laces. Things that don't wear tight clothing that's going to compress against your stomach, that's going to inhibit your breathing. Loose fitting colos. And whenever you're going throughout your day, whether it's bathing or getting dressed or even preparing meals or anything like that, make sure that you're not holding your breath. Mindful breathing in this case is very important. A lot of times when we realize we're about to, have to bend over, like reach, or we're about to exert ourselves in some way, it's kind of natural you're like bracing yourself, and then you like hold your breath a minute. Okay, and then you start going. And so if you have normal lung function, maybe that's a habit that you've gotten into throughout your whole lifetime, but now that your lungs are, have been compromised, you can't do that anymore, because it's just going to make you feel more breathless and more tired. So make sure, if you're eating or if you're bending over, that you're still breathing normally. If you're eating, don't hold your breath while you're, bringing the food up to your mouth. Make sure you're breathing normal. Take smaller bites that you see that you can breathe normally without choking while you're going. If you can't breathe while you're chewing, you've taken too big of a bite. So make sure you take small bites, take a break in between bites. Don't eat in front of the TV so you can sit up nice and tall. That's going to help your eating, and it's also going to help your energy levels. And if you're using that many more calories, you need to make sure that you are putting as much thought into making your mealtime as easy as possible. And by that, I mean making your breathing better, doing the active cycle breathing, making sure your posture is good, that kind of thing, and making sure that you're eating things that are going to be healthful for you. You don't want to be eating a lot of empty calories, basically, things that are unhealthy for you. I'm not saying you can't treat yourself now and again, but when you sit down to eat, make sure you eat the healthy things first. Make sure you cut it. It's very important that you eat protein and fiber. So eat that lean piece of chicken first before you dig into the mashed potatoes. If eating a big meal is often hard for people with a lung condition, because your stomach presses up against your diaphragm. So you want to make sure when you're eating, that's why I said instead of eating maybe 3 bigger meals, eat 4 or 5 smaller meals throughout the day. It'll help your breathing, it'll help your energy levels, and you need to make sure that you're getting all those calories that you need. And we're going to talk a little bit later about the difference in calories, and how to strategize that. Okay. And also plan some downtime in the middle of the day. If you're going to have a busy day, try to schedule it to where you give yourself plenty of time in the morning. Maybe you've bathed the night before, so you have a quicker time getting ready in the morning. Get out during the day, but make sure that you're not just like go the whole day. Plan some downtime in the middle of the day. Where you can sit and rest for a few minutes, maybe do some breathing exercises, do some pursed lip breathing, so to make sure that you're clearing out all that CO2, you're getting all that oxygen in. And also you're checking your emotions. When you get anxious and stressed, we did a whole show on how anxiety and stress affect your breathing. So make sure that you're, relaxing those shoulders, making sure your chest cavity is nice and open, and you're doing some breathing exercises. That's going to help. And also take some time if you're, especially, this time of year, so hot outside, if you've been out and about running errands and things like that, stop to get a drink or something stop at a juice bar or something like that and get a drink of, water or juice or something that's going to, boost your energy a little bit, but also take some time in climate control. So you can get out of the humidity and get out of the heat. It's going to help your breathing. Okay. Donald Neely says, I still need one through my medical insurance without a prescription. Okay. We can't, I'll give you the phone number to call, Donald, but these oxygen concentrators are prescription items, and we can't, and we're according to the FDA, we're regulated by the FDA, and we can't sell them without a prescription, unfortunately. So I'll give you the number to call. Maybe they can discuss, maybe they can help you get a prescription. And we have sources. We can call your doctor's office. We have some telemedicine things that we can recommend. We can get that done. We don't bill insurance, unfortunately, but we can tell you what to do. We give you the reimbursement codes and things like that. So you can talk to a respiratory specialist and they can give you your options. Okay. I'll put the link here as soon as I'm done. Okay. So when your energy levels, so you want to make sure you're getting enough calories and things like that, but you also want to check your emotions. Have you been anxious throughout the day? Are you just, jittery and things like that? That is draining. When I'm going through some things, my brain just goes in a spiral. So I really got to take some time because it is very exhausting and draining. I got to take some time to go for a walk, to sit and just relax a little bit, do some deep breathing, do maybe a grounding exercise. Just really walking just really helps me, walking around the block or something just to kind of get out, kind of gets that nervous energy out, but also helps me quiet my mind just to get outside. So whatever that is for you, whether it's listening to music, whether it's, reading a book, whether it's petting your dog, walking your dog, petting your cat, whatever. But check your emotions, because stress and depression can make you feel sluggish and tired, but also, like I said, anxiety is very draining. And you want to make sure that you're getting good sleep. We talked a couple weeks ago about sleep apnea and other things that can affect your sleeping, such as GERD. And so you want to make sure that if you have any of those conditions, that you've talked to your doctor, maybe they'll send you to a sleep specialist to figure out exactly what, if anything, that you have. But you need to make sure that you're getting good sleep. Nighttime is your body's time to sort of heal and rejuvenate. And if you're not getting good sleep, then, your energy levels are going to suffer throughout the day. So if you don't have GERD, or you don't have sleep apnea, or you don't think you do, and you've talked to your doctor, a couple things that may be keeping you awake at night is a drop in blood sugar. A lot of times people, want to eat early in the day, want to eat like at 4 or 5, and then they don't go to bed till 11. So that's a long time in the evening. With no food. And I don't recommend that you eat a big meal late at night, but if your blood sugar takes a dive in the middle of the night, it's likely to wake you up. You might wake up feeling a little bit out of sorts, or you have a headache, and that's because your blood sugar dropped. So, like I said, I don't recommend eating a big meal at night, but there's some things that you can eat, just a light snack that can bring your blood sugar up and help maintain it throughout the night so you don't wake up in the middle of the night. Or if you do, you'll be able to fall back asleep because you're not, feeling a headache or anything like that. Some suggestions that I found were a handful of nuts or seeds. They're easy to digest. They're, good fiber, good protein, things like that. A hard-boiled egg, possibly. Low-fat cheese with some wheat crackers. Baby carrots or cucumber slices, or maybe some celery sticks with hummus. Roasted chickpeas. A sliced apple with peanut butter on it, or maybe some sugar-free yogurt. A couple things that you may want to avoid, obviously, is caffeine, because that's going to keep you awake. But caffeine also sort of interferes with some of your COPD medications, so they're not going to be working as effectively. And you need to make sure that you're taking your medications as directed, and you're just, keeping your breathing as good as possible. And that means taking your medication, using your oxygen, all that stuff. But caffeine can sometimes interfere with those medications. So you want to avoid that. It's going to keep you up at night, but also it's going to interfere with your medications. And a lot of times some people, want to have a little nightcap. Helps them relax, which it may help you relax, and it actually may help you fall asleep. But alcohol is also very dehydrating. So, if you wake up in the middle of the night, you're likely to have a harder time falling back to sleep. So, try not to do the nightcap at night. Okay. Take your medications, as I said. Do your breathing exercises to reduce CO2 and increase oxygen levels. And breathing exercises also slow your respiratory rate. So if you're feeling any anxiety or any kind of stressful feelings or depression, breathing exercises help that as well. And it's going to help you get rid of that trapped CO2 and help you get more fresh air in. Try to maintain a healthy body weight. If you are too heavy, fat is going to press up against your lungs, making it hard to breathe. And if you have lost elasticity anyway, you need, nice open area there so that the healthy part of your lungs can, try to compensate for that. If you are too thin, your body is going to start eating away at, muscles and things like that, and that is going to make you feel more fatigued as well. If you're too thin, your immunity suffers, your energy level suffers, and also your mobility can suffer as well. So you want to make sure that, you're getting enough calories, and if you're having a hard time eating, you want to figure out why. If it is because it affects your breathing, because of, when you eat and your stomach gets full, pushes up against your diaphragm, eat smaller meals. If it is maybe something that you have eaten, that's why we suggest that you keep a food diary, because there's some foods that just don't agree with you. And there's some foods that just, maybe you can eat earlier in the day, but they give you a hard time if you eat them late at night or, for your dinner meal. So you just want to make sure, if a food is giving you a hard time, figure out why. And there's some foods that you may just have to avoid, but, you just don't want to keep eating those foods so that you can't, they upset your stomach or something like that. And then you can't eat more, or you don't, you skip dinner because you don't feel good at lunch. You need to figure out those foods, because you need to make sure that your body's getting enough calories. Michelle's here, and she said that she's having a hard time keeping on weight. So hopefully these things will help you out, Michelle. Another thing you want to make sure of is that you are getting enough vitamin D. Vitamin D has been linked to decreased lung function, but it also has been linked to fatigue. And especially in winter months, or, during the pandemic, we weren't going out as much. So one of the main sources of vitamin D that we get every day is a free source, the sun. But in the wintertime, we don't have very much sun. And, like I said, we haven't been going out. So you want to make sure that you're compensating for that by getting more vitamin D in your diet. And I will talk about some sources of that a little bit later on. And you want to make sure that you are drinking water. You say, she finds a way to, slip that water in on us every week. I do, because it's important. It's a common exacerbation trigger, and also the easiest one to prevent. But it also has been found that dehydration not only affects your breathing, but also affects your energy levels. The American Lung Association suggests 6 to 8 ounce glasses of water every day. That's a lot of water. So start early so that you don't have to, you don't have to go to the bathroom too much at night. Get some of that water out of the way earlier in the day so that you can, have an easier evening, I guess. Okay. So eating smaller meals more often is not only going to help your breathing because it's not going to fill up your tummy. It also helps you sort of space out those calories throughout the day. So if you eat at 8 o'clock and then you wait 4 or 5 hours and you don't eat anything, and then you eat again and you get all those calories and then you don't eat again. But if you eat some like healthy snacks in between those and eat, a lighter meal before bed, it's going to help space out those calories a little more so that you can maintain energy levels throughout the day a little bit better. Make sure that you're getting 25 to 30 grams of fiber every day. Fiber is good for your digestion. We've talked about your gut health and your immunity and your lung health, how those all, your lung biome and how those things all work together. And fiber is essential for all of that. So make sure you're getting 25 to 30 grams per day. You could eat a bowl of bran cereal, some whole wheat toast or something like that. Also, oatmeal is good for that. And if you mix oatmeal with milk, first of all, it's going to add a few more calories. So if you're struggling to put weight on, but it's also, add some nutrients there. As we talked about before, sometimes COPD medications are not good for your bone health. So it's important that you get calcium and some things that you can find in milk. So, mix it with milk instead of water. It's rich in fiber. That's going to be rich in calcium and vitamins, iron, and it's also going to help. Oatmeal is also good for your cholesterol. Last week we talked about heart health, so it's good for your cholesterol. Eat nutritious food first. We talked about that. And cheese will increase the nutrient value and calorie value of any meal. Add some calcium. So if you can sprinkle some cheese on top of, in whatever meal, it's going to add a few more calories. It's also going to add a few more nutrients. If you're trying to take off weight and you still want the nutrients, look for skim or, lower fat cheese. Eggs are another thing that can offer a caloric boost. Eggs sort of got a bad rap back in the 80s that they raised cholesterol, but they've since found that is really not true. Eggs in themselves have a lot of cholesterol in them, but they found that doesn't really affect the cholesterol within your body. It doesn't raise up that bad cholesterol in your body. But it also depends on how they're cooked. If it's slathered in butter or like oil, things like that, those are trans fats, which do raise your cholesterol. So you want to make sure that you're cooking them healthy, or at least cook them in a light oil, like olive oil or something like that. The healthiest ways to cook an egg is either poached or boiled. And it can either be hard boiled or soft boiled. But those, because you're not using any oil. But like I said, if you're going to use oil, you don't want to scramble up an egg or something like that. At least make sure you're using a light oil like olive oil. You can also mix it into, if you're going to make a meatloaf or something like that, you can crack an egg and mix it into the meat. It doesn't really add to the taste so much, but it's just going to add, if you need a few more calories and you want a little bit more nutrition in there, add that egg into the meat and it's going to add those things for you. Make sure that when you're snacking in between meals, you're not eating something that is going to, first of all, be bad for your health, or is salty, because that's going to help you retain water, which affects your breathing. And make sure that you're having healthy snacks that are going to, benefit your health in some way. That's omega-3s. We've talked about how those are good for anti-inflammation. Low-fat pudding cakes, crackers with cheese, and like I said, you can use skim or low-fat cheese. Fruits and veggies with a dip, like a yogurt dip, is good for that. Any of those things would be good. When you add fruits and vegetables to your diet, you can't really go wrong. Make sure that you're following your food diary so that if any that make you bloated or don't agree with you, you can just avoid or try to prepare them differently, or have a smaller portion, depending on what you found in your diary. Starchy vegetables like beets, corn, carrots, and winter squash are rich in vitamins and minerals, and have more calories than other vegetables. So if you need those calories, try some of those. And soup, if those richer vegetables don't agree with you, you might try them also in soup, because that sort of breaks down some of the fiber, which I think is what makes a lot of people bloated. But if you put it in the soup, the fiber's still in there. If you chop up celery and put it in soup, the fiber's still there. It doesn't go away, but it just breaks it down a little bit more so that it's easier for you to digest, easier on your stomach. Or you can also, if you're going to have vegetables, boil them for a few minutes. And sometimes that takes out some of the nutrients, but if you're making soup, if you use the water that you boiled the vegetables in and put it in there, retain the nutrients. So try that if you have trouble with too much fiber. And you can also get a boost of protein by adding dry milk, protein powder, or soy protein to, like mashed potatoes or casseroles, soup, or even your hot cereal. You can put a little bit of powder in there, mix it in. It's not really going to affect the taste. It's just going to give you some nutritional benefits there. Peanut butter is good. That's my favorite, like, evening snack. Peanut butter is good for calorie boost and protein. Have like a couple crackers with peanut butter, a little bit of honey on the top sometimes, and it's a good nighttime snack. It's also good for protein, like I said, fiber, and it's also going to help your blood sugar maintain throughout the evening. And so the best sources of protein, like we talked about, eggs, lean meat, fish, poultry, legumes, and nuts are the best sources of protein. Okay, so when we talk about energy, the three things that affect your energy, the three nutrients that affect your energy levels the most are carbohydrates, protein, and fats. Those are the three main nutrients that are used for energy. So carbs convert sugar to glucose, and carbs convert the quickest. So if you're looking for a quick boost of energy, if you eat something, some refined sugars or something like that, you're more likely to get, something like that from simple carbs, but they burn out quick too. So you might get a quick boost of energy and then you're going to crash again. So if you're going to eat carbs, because they do provide a lot of energy, you want to make sure that you are sticking to complex carbs, such as high fiber cereals, whole grain breads and pastas, dried beans, starchy vegetables. They're the best ways to keep for that prolonged energy to go. So, simple carbs are just going to give you a quick boost. It doesn't last. But if you eat those complex carbs, your energy levels are going to maintain better throughout the day. Also, foods that are high in fiber, protein, and fat take a longer time to digest. And that's why they say, if you're trying to lose weight, you want to avoid those things. You want to just, stick to a low carb meal and, lean proteins and things like that, because they take a longer time to digest. But fats they're a good source of energy, especially like healthy fats I'm talking about. They also help your body absorb some more vitamins. And unhealthy fats, such as, trans fats, saturated fats, those fatty oils, things like that, they stimulate serotonin production. And serotonin, as you probably know, is, for sleep. So it's going to make you feel kind of groggy and sluggish, things like that. So stay away from those unhealthy fats, and things like avocados, lean meats, dairy, fish, nuts, olives. Olives are another, good snack. Try to get the ones that are low sodium so you're not affecting your water retention, but they're a good source. And proteins build and repair your body structures. As we always talk about, protein is essential for muscle health, and breathing is largely a muscular function. So you want to make sure that you're keeping those muscles healthy and fortified with nutrients. And proteins also help produce body chemicals. They carry nutrients to your cells, and they help regulate a lot of different body processes. So you want to look for things that amino acids can be produced in your body. Proteins are made from elements called amino acids. Amino acids can sometimes be produced in your body, but there's many that you'll see foods that contain essential amino acids, and that means that those are the amino acids that your body can't produce. So if you're looking for a good, healthy, lean protein, look for those things, and we're going to have I'll have some sources for you. And I just want to, we're going to talk now about vitamins. People in here are always asking me about vitamins and minerals and things like that. Vitamins and minerals don't provide any energy in and of themselves. What they do is they help your body convert food into energy. So vitamins such as A, B complex, C, D, E, and K, they help your body convert those carbs, fats, and proteins into energy. So those vitamins are essential for, if you're trying to maintain your energy levels. So vitamin A, you'll see some of these foods are, on more than one vitamin, so that's good. But vitamin A, eggs, milk, carrots, and sweet potatoes are all good sources of vitamin A. Vitamin C, oranges, strawberries, tomatoes, kiwis, red and green bell peppers, and broccoli are all good sources of vitamin C. Broccoli is also good because it contains sulforaphane. Sulforaphane is one of the things that they're looking at that can actually possibly help, stop lung damage or else even, slightly repair some lung damage. They're still doing a lot of research on that. So, we'll stay tuned to that. But sulforaphane is beneficial for lung health for sure. Vitamin D. Best source of vitamin D, like I said, the sun. Also, oily fish such as salmon, sardines, herring, and mackerel. Red meat, lean red meat, and liver and egg yolks are good sources of vitamin D. Vitamin E, the best sources are avocados, nuts, seeds, whole grain foods, spinach, and other dark leafy greens. B complex, there's a lot of foods that have B complex vitamins such as milk, eggs, cheese, liver. Oily fish that we talked about before, and shellfish, especially oysters and clams, are good sources for B complex. And also those dark leafy green vegetables such as spinach or kale are good for vitamin K, or excuse me, B complex. Vitamin K, cabbage, cauliflower, tomatoes, spinach, eggs, liver, cheese, and other dairy products are all good for vitamin K. And for energy, I found this list that I actually thought was pretty good. And it is compiled by a doctor, Dr. Kathleen Zellman, who writes a lot for Nutrish, which is Nourish, which is the nutrition arm of WebMD. But I've seen a lot of articles by her, and I feel like she gives a lot of good information. Her name's Kathleen Zellman, and she put together a list that she called High Octane for Energy. These are foods that are rich in complex carbohydrates, protein, antioxidants, fiber, vitamins, and minerals, and combined with healthy fats, provide a balanced diet that are good for energy levels. And the foods that she listed on this list are blueberries, beans, cantaloupes, strawberries, mangoes, spinach, salmon, nuts, tea, especially green tea, tomatoes, soy, low-fat dairy, oatmeal, whole grains, citrus fruits, peppers, and sweet potatoes. That was her list for high-octane energy foods. So, keep in mind that you want to have protein for muscle health and also for energy, fiber for digestion and for immune health and also for energy. Antioxidants, good for immune system, fighting off disease, and also, good for energy levels. And you need carbs because you need some of those for energy. They convert most quickly into sugar, but make sure that they are those complex carbs that aren't going to produce too much CO2 in your body, and they're going to give you some energy. And be sure to stick to healthy fats. Good balanced diet. A lot of people are always asking me for a list of healthy foods to eat and not to eat. And, I wish it was that easy, but unfortunately it's not. You're going to have to figure out using your food diary or what, speak to a dietitian or something like that to figure out what foods are going to be best for you. In this show, we talk a lot about foods that are good for health, lung health, and heart health and things like that. But in the end, it's your food diary that's going to have to guide your eating, especially if your condition is, more, depending on where it is, more advanced. You're going to have to go with your food diary because you're not going to, even if you try to eat something that's healthy, but it doesn't agree with you, and it's going to affect your sleep, which is going to affect your health, or it's going to make you feel bloated, which is going to affect your breathing. So, take the information that we present on this show, and maybe it'll give you some good ideas of things you don't normally eat. I know I myself am sort of a creature of habit. I eat the same things a lot of the time. So if you can get a better idea of something that is healthy, and it's like, hey, I'm going to try that. It sounds healthy and it sounds good to eat, or different way to prepare something. But if it doesn't agree with you, or if it does, it makes you feel really good, make sure you note it in your food diary so that you'll know for next time. And that food diary, make sure if you go to see your respiratory therapist, or you start talking to a nutritionist or a dietitian, take that information with you, because that is going to be essential info for them, because then you're not starting from square one. You've already got some data compiled, and they can help you, because just like me, there's no list of things to eat and not to eat. It's going to affect everybody differently. So if you can give them as much information as you can, it's just only going to help them help you better. So thank you for watching. Next week, we're going to talk about another topic that we got asked last week by Azalea. She wanted to talk about arterial blood gas tests and what the results mean, how to interpret those. And so we're going to talk about that next week. We're going to talk about pulmonary function tests, how those work, how the arterial blood gas tests work. And so if you're newly diagnosed, it's definitely some information that you need to watch. But thank you so much for watching, and I appreciate you being here, and I will see you next week. You guys have a good, healthy, and relaxing Labor Day, and I will see you next week. Take care of yourself. And if you are in Louisiana, you may not be watching now because you don't have power, but we are thinking about you. I have soft spot in my heart for New Orleans. I love that city, and I'm thinking about you guys. And stay safe. Take care.